chest or pain or shortness of breath. Shortness of breast. Hey guys, hope you had a good weekend. I am going to talk to you now about the second half of what the Bariatric Program Administrator talked to us about in our Preop 2 class. The first thing she talked about with weight loss surgery was some rules to live by post-operatively. Because we're going home and yay, we're all fixed up. Doctor has made our stomach pouch smaller and it is now up to us to lose the weight. So these are some rules to live by, to think about in the back of our minds, because the fatty eater in us is going to want to eat the same way that we've always eaten. So we want to always make sure that we are eating slowly and thoroughly, something that I'm sure you've heard about through your process as well. You know, 15 to 20 times per bite or more. And it's gonna take us about 30 minutes to get through a meal. And I don't know about you guys, but this one's gonna take me a while, and I've been trying to work on it myself before I started this pre-op diet. And yeah, it is a challenge. I eat very fast. You're gonna be eating 3 small meals a day and about 2 protein snacks in between. That way, if you are getting hungry, you can have a snack, but you want it to be protein, so we're keeping within our calorie range, and you still wanna make sure to log your food. I have never been good at logging my food, so I've been trying to really work on it and be good at it, and it's, once you get used to it, I will say that I'm finding it easier to do it every day, but it is kind of a hassle, especially right now with everything being the same meal. So it's just like swipe to add the same meal as yesterday. So, but whatever, it's getting there, and it becomes a habit, it won't be a big deal anymore. And that way we can really keep track of what we are actually putting in our bodies. 8 glasses of water a day. It's simple, guys. We've been told this since we were little. Most of us are, I heard it best, I believe it was from that Dr. V that I told you guys about in the last video. He says that we are used to being eating machines, but now we need to focus on being hydration machines. We need to get that water in, and I know that I'm not very good about it. I've been focusing on trying to get more liquid in. So on that pre-op diet, when we are getting in those popsicles and that broth and that jello, all that is going towards our water intake. And so that's really helping, and I am trying to work on that, and I feel that it is helping. So I'm not going to really touch on what the instructions are for us at Covenant going into surgery and the day of surgery and stuff like that. I'll touch on it just quickly here, but I'm not going to go too in depth because your surgeon in your hospital, wherever it is you're having your procedure, I'm sure that their instructions might be a little bit different. So you're definitely going to want to pay attention to what your doctor tells you to do. But for us, the last day before surgery, you're gonna want to stay away from that last meal. They again, like I told you guys, they have found people who have gone into surgery and they have found food in the stomach because, you know, that last night of that pre-op diet, they say, well, I'm gonna have one last meal, one last hurrah, and then that food didn't get properly digested long enough, and here they are finding stuff that wasn't even allowed in the pre-op diet, the vegetables or anything like that, in the stomach when they go to get smaller, and that in itself can be a risk. So that's one of the things they do say in the day before surgery, make sure you avoid. They then talked about all the gastric bypass patients. When you get back to recovery, they will have a drain in one of the incisions, and this is called a Jackson Pratt drain, and they are removed by the nurse before you go home. They just help monitor, like, you know, like the fluids inside, because yours is a little bit more extensive than the sleeve or the lap band. Also, depending on the type of procedure and how the length is going, you might have a catheter also, and that will be removed day after your surgery. First day you're going to be on a clear liquid diet, so yay us, you know, more like, you know, broth and such that first day, but you're probably not going to feel like eating anything anyway. It'll be more like ice chips and like a swab with some water in it to just kind of dampen the inside of your mouth. So it's discharge day. It's time to go home. So what they recommend for us is Covenant, you're gonna have these TED hose that they pull up to your knees, and also these SCD pumps that just kind of like massage your legs and just pump, and those help prevent blood clots. And you're going to want to keep those on and functioning at all times while you are in the bed. But when you're up and you're walking, you can take those off and feel free to let loose, because you're letting the blood flow on your own, whereas if you're in the bed, those SCD pumps are helping pump it for you. When they discharge you, the doctor will then advance you to a full liquid diet. That's also going to take that drain out that I told you guys about. You're going to get home at Covenant. Our post-op appointment is already scheduled before we even go in for surgery. But if it's not, when you get home, you're going to want to make sure you call your doctor's office and get a post-op appointment. Typically, they do it about 2 weeks out. That way, you're on the full liquid diet, and they want to make sure that you're able to get in those protein drinks and the fluids before they advance you on to a pureed diet. So you're going to get that post-op appointment scheduled. That way you're all ready once you get home. Post-op experiences when we are home, it's going to be normal to feel discomfort or, you know, anything in that abdominal area. Mostly the pressure and pain that we're going to feel is gas, because what they are doing is they, you know, with those laparoscopic tools, they have to pump air into our abdomen, but they can't get all the air. They try as best as they can, but sometimes air will be behind like an organ or something, and they can't get it all. So most of the time that pain is related to gas. That's why another reason they really stress getting up and walking, because that's going to help break up that air in our abdomen. It also talks about the transition home. You're going to want to keep those TEDs on that they give you. They're going to discharge you with those TEDs that I told you about that go up to your knees. You want to keep those on until you go and see the doctor, because they help prevent blood clots like we talked about. Those are going to be a big thing until doctor clears you to take them off. It's like with any surgery. Most surgeries, when you go in and have something big done, you do have to have those on, and you do keep them on for quite a long time until doctor says it's okay not to. They also do sell some compression socks at the store, so if you want to obviously change those out and get different ones on, feel free to do that, and just buy some ones at the store. They're not that expensive. I do recommend it. They have them in different colors too, because the ones they give you at the store like stark white. So if you want to like wear like a dress or anything out anywhere, you're gonna have to wear like some stockings or something over it, just so it gives it more of a flesh color. So they do have some at the store that are in different colors and can be a little bit more adaptable to your outfit. Medications, you're still going to want to crush them for about 6 to 8 weeks after surgery. You're going to want to talk to your doctor about that. They talk about lifting. No lifting more than 10 pounds for about 2 weeks after surgery, and no more than 15 pounds for about 4 weeks after surgery. You're going to want to shower daily. No tub baths until you see your doctor and he gives you the go ahead, because you don't want to open up those incisions. So one of the big things post-operatively, guys, you cannot drive for about a week after this procedure, and depending on if you are taking pain medication, it could be longer. You can return to work as soon as the doctor clears it. You can be off work for up to 6 to 8 weeks, depending on what you do. If you have more of a sedentary job and you just sit at a desk, you can go back sooner. Bowel movements. This goes back to that milk of magnesia. If you guys haven't gone to the bathroom in 2 to 3 days, you're going to want to take some of that milk of magnesia. So major issues that you're going to want to get a hold of the surgeon's office is if your fever is greater than 101, orally for 24 hours. If your incision opens or anything, or swells, or if there's any pus or there's a funny smell, you are going to want to get a hold of him, along with nausea and vomiting, calf pain, dizziness, chest pain, or shortness of breath, bleeding, anything like that. You're going to want to definitely get a hold of your doctor's office as soon as you can. They do kind of talk about the complications post-operatively, which I'm sure that your doctor has probably been talking to you guys about, and such as nausea and vomiting, because again, they're working with that stomach, and infection, because if you aren't clean and when you're washing your hands or touching your incision points, or if you take a bath like you shouldn't, or like in a pool, and those kind of things can get into your incisions and get you sick. So we want to definitely try and avoid anything we can. Another reason why we have a weight restriction is because we can get hernias in our incision points with dehydration. Like, we want to be hydration machines and get in as much water as we can, and that way we can stay hydrated. And they talk about some more complications in this book, but I'm not really going into it too much because I'm going to leave that in between you and your doctor. Additional complications though, I will kind of touch on those. Along with the incisional hernia that I talked about, you can also get an internal hernia where the your bowel can twist, and they can present shortly after surgery or months out, up to about a year. And signs of that is analyzes like abdominal pain, constipation, bloating, and it's, from what I've heard, it's very rare, but they have to obviously tell you about it, along with the dumping syndrome, and that mainly is associated with the gastric bypass when you eat something that is too sweet, high in calories, or fatty or greasy. So when you have a gastric bypass, you want to definitely limit those and stay away from those as much as you can, because you are most likely going to get that dumping syndrome. They talk about some signs of dumping, some early signs of dumping begin during or even right after the meal, and such as like nausea, vomiting, bloating, get a flushed feeling, shortness of breath, and then there's also some late dumping. Occurs 1 to 3 hours after eating, and possible signs of that is weakness, sweating, dizziness, and some abdominal like cramping and pain. That's basically what she talked about in her portion of the meeting, and so I'm gonna wrap up here, and I'll be back next time to talk about what the dietitian talked about in her portion. And yeah, it's Monday, so a few days away. Thursday is the big day, guys. I'm getting so stoked. I can hardly stand it. So I am gonna wrap up here, and I will see you guys either tomorrow or Wednesday. Oh, and just so you guys know, I have lost about 10 pounds. Yes, over 10 pounds actually, on the pre-op diet. So yay. Yeah, so good luck. And I know it sucks. I've been through it. I'm doing it. And once you get to the halfway point where you can't even have like the vegetables and everything else, it sucks. But at the same time, you're not even really hungry anymore. You're just kind of sick of it. So I'm just kind of forcing myself to take in those protein drinks, which at this point I'm already kind of tired of, so God only knows how it's going to be post-operatively. I'm looking forward to soup, lots of soup. So I'm gonna let you guys go, and I will see you in a few days.